Well, I think the pain points are the same for us that they are for any healthcare system. It's the need to have real-time actionable data for providers, and you're not going to be able to get that out of an EMR or practice management system. And it's just as important to know what's going on for the patient in front of you as what's going on with the patients that aren't in front of you. And the typical EHR and other technology systems we have available to us just can't give providers that level of detail. And without that level of data and detail, they can't close those gaps in care and make a difference in the patient outcome. But for those who have really embraced it and become super users, they're able to identify those gaps in care. They're able to encourage the entire care team in the office to help close those gaps in care. So it's not the sole responsibility of the physician. When patients are coming in, the front desk girls have reports on what those gaps in care are, the medical assistants, the nurses. And so everybody has real-time data that allows them at point of care to make a difference in the patient. But for the nurse practitioners who are working those care gap reports, it's giving them the data and the ability to reach out to those patients who aren't showing up in the office to have their care gaps closed as well. Well, Phitel is assisted in that we're able to deploy the technology not just for physicians who are employed by Orlando Health, but those who choose to join our clinically integrated network. We're using Phitel to deploy it in their offices as well, which means we're enabling the providers to work on the same gaps in care, to work on the same evidence-based protocols, to be reporting out the same data, which is allowing them to come together and collaborate on patient care in a way that the disparate EMRs many of these physicians find themselves on are not going to allow them to do. We're tracking our adherence to those measures now, and obviously the goal is to make sure that we're hitting the quality scores for all of those metrics. But I think the larger vision is that as we work with different payers or self-insured employers who may want us to track and report out different metrics, that we are working with a vendor and a system that has the capability to customize that for us. I do feel confident that Phitel will get us there. That was a big push when we selected them as our vendor, and they were very committed to getting us to reporting capability for the 33, and they met the timelines and the deadlines for that, and so I feel good about their ability to customize that going forward. You know, in point of fact, the executive team has discussed the fact that a couple years ago we were saying no to risk, no to even the thought of risk, no to risk anywhere on the horizon. Now with Phitel in place and the quality of the data that we're able to report out and the work that we're able to do closing those gaps in care, and I think some future capabilities that they're going to have regarding claims data, we're starting to get a lot more comfortable that our timeline for accepting risk may be moving up. In fact, when we selected Phitel, my major concern was that they were not importing adjudicated claims. And without adjudicated claims, you're not getting the 360-degree view of the patient. I know I prescribed you a medication. I have no idea if you went out and got that medication filled, and therefore you have a gap in care I'm not aware of. And expressed to them that there were vendors out there in that space who did a fairly good job of incorporating adjudicated claims and providing risk stratification, and mentioned Verisk as one of those vendors. We use Verisk for our own self-insured population. So I was very excited when the two of them decided to come together. We're anxiously awaiting the integration of the two. We're working with Verisk now to be able to incorporate that claims data, and our providers are very excited about the possibility that we'll begin to get that more robust 360-degree view. Because without the adjudicated claims, you miss what happens when the patient leaves your office. You also miss other sites of care that they may be accessing that aren't a part of your system. So if we have a patient who's a frequent flyer in the emergency department, but not our emergency department, we're missing that opportunity to close gaps in care for them and keep them out of the emergency department. So you've got to get those adjudicated claims in so you know what's happening to the patient outside the four walls of your clinically integrated network. We have a physician who is actually using Phitel to identify gaps in care for patient populations and then scheduling group visits. So he's having whole groups of patients come into his office who have the same condition, and they have a group visit with he and his nurse practitioner where together they can share success stories about diet, exercise, medication compliance, share symptoms that they're having, and he's finding it to be an incredibly effective tool in engaging patients in their care process and getting better compliance. He's a huge fan of the product. The integration of Phitel and Verisk, I think, is going to make not just the move from volume to value, but more importantly, the move to being able to assume a risk for a population simple. We're all headed back towards risk. And the faster that we can get there, the faster all of our efforts to lower the utilization of healthcare services are actually going to have a payback. I would tell them that we use FITEL. I would strongly encourage them to consider it because it's the only technology tool in the healthcare space in my career that the vendor has met all of the deadlines, met all the promises, done relatively straightforward and easy interfaces, and more importantly, that our providers are reporting they find value at point of care from. Real actionable data that allows you to make an impact to the care you're delivering to patients is not something that other technology tools provide. They just don't. I think a lot of them purport to do the same thing related to closing gaps in care, but very few of them have robust patient engagement features and specifically automated features that allow you to take some burden off of staff and have that automated to reach out to the patients. So I think first and foremost, they compare favorably on being forward thinking and how to engage the patient in the process. I think secondarily, a lot of companies out there right now are purporting to do a lot of things, but I can't stress enough that I wouldn't be here advocating for a product if it wasn't for the fact that they've lived up to their promises. Lots of folks in the past have promised us lots of things and haven't lived up to it. In our world today, most health systems know that you don't end up working with just one EMR. And if you're looking to work with community physicians, you're going to end up working with a lot of different EMRs. And working with a vendor who has experience having already written interfaces with multiple EMRs is going to save you considerable time and resources on deployment.